So my name is Melanie Froggatt. I represent the Save Our Mental Health campaign in Dorset, primarily representing the rural areas of Dorset. This is the consultation document itself.
What do you think the strengths are?
So the strengths are that they actually are increasing beds, inpatient beds for acute mentally ill patients. They are introducing a 24/7 connection phone number so that people can ring in a crisis, not just ring in 999, which is fantastic. They would be put through to a crisis team 24/7. They can self-refer into any of the services rather than have to wait to see their GP. There is a new service called a community front room, which would be in a cafe, library, day centre. Those are the sort of settings they're talking about. So this is early intervention. So somewhere if you're starting to feel a little bit wobbly, that perhaps you'd be able to go and see either a peer support worker or a healthcare professional.
So the early intervention
is absolutely key, is something that was really lacking. And then they're also introducing 2 retreats, which will have recovery beds and clinically qualified mental health staff, as well as peer support workers. So primarily the document itself, what the CCG are proposing is actually quite good. On the face of it, I actually do support it. The things that I don't support is they seem to have concentrated on the 66% of the people on the serious mental illness register being in the conurbations, so being in Bournemouth, Poole, Dorchester. So all of the services and facilities that they have gleaned from that are south of Dorchester. And I'd just like to point that out to you on the map.
What page is that?
This is on page 11 of the mental health consultation document. I've actually written it here, 0 services in North Dorset. So, first of all, Dorchester is not this high up, it's down here. So you can see very clearly there's a north-south divide here, okay? With rural mental health, it's very, very important that they have some kind of service in North Dorset, being the second largest concentrated population in Dorset. So there isn't actually any provision apart from a community front room that they're suggesting to be in Sturminster Newton. Now, they're suggesting this, the community front room, a Thursday to Sunday. There isn't actually a bus service on weekends from Shaftesbury and Gillingham, so that's effectively half the service they're offering us here. What concerns me most is the inequality of service provision in the mental health consultation itself. They failed to look at the 34% of the population in rural areas. So if people are in a crisis situation or nearing a crisis situation, if they live in North Dorset or the rural areas, they're going to have to go in their car, which in itself is worrying if you're going through a crisis.
That's if they have a car.
If they have a car, at least an hour's journey to Dorchester, Bournemouth, Poole. Those are the areas. When I met with the CCG at the public event at Abbey View Surgery in Shaftesbury on last Friday, I put it to the Senior Commissioner about the inequality of the service and the fact that had they considered taking the 15 beds that they are going to close from Weymouth, the Linden unit, which is in their proposal, and moving those to the north of the county, rather than adding to St Anne's in Poole and the Forston Clinic in Dorchester, because that way you can quite clearly see then that would be a triangle covering quite a lot of Dorset itself, and it would actually address the inequalities in the rural services.
Melanie, can I ask, this is quite well known about rural inequalities in terms of mental health.
Yeah.
And I worked in mental health, as I said to you, for about 30 years.
Yeah.
That was being pointed out 25 years ago in terms of the rural inequalities. And one of the tasks that the CCG has to accomplish in terms of health outcomes is equality outcomes. So you're saying that you want to challenge that document
yes.
in terms of your concerns, specifically around the outcomes around North Dorset, because what they're suggesting is what you're predicting is health inequalities
Yes.
For people with severe and enduring mental health problems.
Yes.
Okay. Can I ask you, I went along to one of the consultations and similar arguments were being presented from Weymouth colleagues that if they move the Linden unit up to Dorchester, the same argument you used, Melanie, about North Dorset, you're robbing one area to support another, and their criticisms were almost identical to you. Do you think there's an argument that acute units are needed both in Weymouth, like the Linden unit, and provision in North Dorset as well, are properly funded and not robbing Peter to pay Paul?
I would support that completely, and to take out beds from any area is just not
Because
right.
sections have gone up, haven't they, year on year?
But the
And
issue
what we
that
mean by sections are people who need acute beds, and there haven't been enough.
there haven't been enough, and what I was given that answer was, we've only got the money for what's in this proposal. They said to me, if you had a magic wand, what would you propose? Of course, I said that 2 retreats, for example, are not enough for the whole of Dorset. That's the recovery beds and the medium, not crisis, but perhaps a step down, not the early intervention, the in-between. So 2 retreats, even though these are new services, are actually inadequate for the whole of Dorset. When we were talking about closing the Linden unit for inpatient beds for crisis, talking about moving them to the Forston Clinic and the St Anne's, the reason I suggested to move those 15 beds into North Dorset is because Shaftesbury and Gillingham, for example, are 25 miles plus to Dorchester. Dorchester and Weymouth are about under 10 miles apart. So although it's not acceptable for Weymouth to lose beds, in North Dorset we don't have anything at all. The nearest is 20 odd miles to either Yeovil or Salisbury.
So in terms of what you're trying to suggest to people regarding filling that document in, is read it,
yes,
get along to the shop in terms of asking for advice, and raise the strengths of that document, but also highlight those concerns. And those concerns, in a nutshell, are what?
The concerns are that it seems to have been geared up for 66% of the population in the urban areas, and they seem to have neglected the 34% in the rural areas. My main concern about the rural areas, North Dorset and other rural areas, is that they've said on page 17, people who use services and help to participate in the modelling told us they would be willing to travel up to 25 minutes using their own car based on a travel time analysis. The locations that provide the best access to the highest number of people are in this proposal. This is what they're talking about: Dorchester, Weymouth, Bournemouth, Poole. Okay. Now, 25 minutes from Gillingham and Shaftesbury, 25 minutes is not going to get you halfway to Dorchester. So it concerns me, who are those people that they've consulted with to help them with the model of care here in this document? Okay, and the thing is, where is the duty of care on the NHS to provide a service to people when they're in need, where they haven't got to get in their car, whether they're on medication, whether they actually should be physically able to drive, and with a public transport system that is actually, there's depleted.
And it
very,
doesn't
very
exist
depleted.
over weekends in some of the areas.
It doesn't exist over weekends, and also need to point out quickly that this summer, this July, the Dorset County Council are looking at the bus services in Dorset and reducing the numbers from 35 services down to 7. So that's going to have an impact. Hasn't even been mentioned in the document at all.
So thank you very much for ringing those alarm bells, and as you say, pointing out some of the strengths, but also some of the major concerns that you have. Thank you very much, Melanie.
Okay, thank you.